Hi, this is Dr. Thomas Bartell, board certified plastic surgeon specializing in body recontouring surgery. And I'd like to touch on a topic today that's becoming an increasingly big part of my practice, and that is body recontouring for men. Years ago, it would be unusual for me to be taking care of a male for any type of cosmetic surgery, but now it's really becoming quite common. There are several instances that men will come in to consult with me. One of them is after someone has lost a great deal of weight and they have a lot of hanging skin, and I've talked about this in previous Facebook Live sessions, where skin can be hanging from various parts of their body. Typically it's their arms or their chest and their abdomen and thighs and so forth. And these types of problems I correct just like I do in the women. But the most frequent male problem that I treat is something called man boobs, or some patients will look online and it will be called gynecomastia. In truth, true gynecomastia I don't see very often. Most of the patients that come in to see me just have extra stuff on their chest. Medically speaking, it's pseudogynecomastia, and that's a good thing, because with the relatively milder cases, this is something that we can treat just with some liposuctioning and a little direct excision of breast gland alone, with minimal scarring. I say we have to remove some of the breast gland. Men have breast glands. We have nipples. We have breast glands. It's just they're not developed the way they are in women. But what we do is we do some liposuctioning, and then you can really feel the breast gland. But this is all done through a tiny little incision right around the areola, the colored area, so that once that scar fades, completely matures, it's hard to see a scar at all. Don't even know I was ever there. So you can take a situation where a guy is embarrassed about taking his shirt off, for a sporting event or on the beach and so forth. Or many cases, these guys will come in and they're wearing an extra tight-fitting shirt underneath their shirt to try to compress everything down. And they can, after they're finished with me, they can go out and walk on the beach and look like all the other guys out there. As I say, this is a very common procedure now that I'm doing. We still do it under general anesthetic, so you're put to sleep. You don't have to worry about seeing anything bad or feeling anything bad or seeing anything gross or anything like that. It doesn't take very long, maybe about an hour and a half at the most. Post-op recovery is very quick. Most guys who are at desk jobs are back to work in 4 or 5 days. And it has a very high patient satisfaction rate. Now, if I see a patient with true gynecomastia, or a significant amount of excess tissue that there's extra skin involved, then we do have to leave scars, unfortunately. Now I try to put the scars in a place that's looks more like just a regular skin crease in your chest. But these are the patients that really have the most dramatic results. I mean, you take a guy who would be horrified to take his shirt off because his chest looks like a woman, and I can turn that back into a male contour, but it does take a little bit more surgery and, of course, a little bit more scarring. But these are patients that have really a very high level of satisfaction. So if you think that you have man boobs and you're embarrassed about it, there's no reason to stay that way. Give us a call over here at my clinic, or go online. You can see some before and after pictures. We can discuss it, and you can get a free quote, find out what it's all about, and I'd be happy to improve the appearance of your chest. Sometimes I even change lives. So anyway, Dr. Thomas Bartell, hope everyone's staying warm. See you next time.